Thank you, Commissioner, and thank you to the many people involved in making this event happen. Special thank you to the Secretary of Agriculture and his team for the wonderful video and the ones to come. Public Service Recognition Week has been celebrated nationally since 1985 as a time to honor public servants in federal, state, county, and local government. The pandemic changed the way we typically have honored this tradition, and as we've seen over the last year and a half, there have been some silver linings, and today's virtual event is one of those. The wonder of Teams and ADS have provided a way for our governor, other statewide elected officials, and the cabinet to personally thank all of our executive branch employees for their incredible accomplishments. At no other time in my 40 years in state government have I been more proud to be part of such an extraordinary group of enterprising individuals. Agencies, departments, and divisions came together and worked with external partners collaboratively to ensure guidance, safety, and security. Throughout this pandemic, state employees have gone above and beyond the routine and made even greater differences in the lives of Vermonters during a great time of need. Your strength, your resilience, and your efforts were and continue to be amazing. The ingenuity of frontline workers, the ability to think outside the box, and the camaraderie that rose to the forefront in the face of adversity improved the quality of your work in meaningful ways that will last this pandemic well into the future. The mental, physical, and financial needs of Vermonters and businesses were addressed with compassion, competence, and creativity in countless ways that will be highlighted today. You've taken on additional responsibilities to meet the demands of this pandemic and have set the very highest standards for service in Vermont state government. Every day, you truly make a difference. I personally applaud and thank you.
In February of 2020, the Department of Health activated the Health Operations Center, or HOC. Shortly after that, the State Emergency Operations Center, SEOC, led by the Department of Public Safety Emergency Management, was activated to manage the statewide emergency. The SEOC divided its work into several branches, and here's just a sample of all of their coordinated work efforts. The SEOC Logistical Operations Branch, which organized, supported, and coordinated sources of equipment and facilities needed to respond to the COVID-19 pandemic, included temporary morgue sites, food distribution, COVID testing clinics, alternate care sites, isolation and recovery sites, vaccination clinics, vaccine distribution literature and signage, furniture and equipment, and a wide variety of other logistical matters. After the activation of the HOC and the SEOC, multiple state agencies came together to assist the Agency of Human Services to develop an AHS SEOC branch, which consisted of all AHS departments in the central office, the HOC, the SEOC, and many other agencies and departments, including agencies of education, transportation, and digital services, the departments of public safety, buildings and general services, military and human resources, and external partners as well. And they all were supporting many efforts, including homelessness and congregate living sites, quarantine housing and alternate care sites, mass feeding for school-aged children and for the unhoused population, transportation for quarantine and alternate housing, outbreak support for correctional facilities, long-term care facilities, schools, work sites, and communities, financial recovery, servicing the limited English proficient population, developing testing sites, contact tracing, staffing support, procurement of supplies and PPE, support for childcare activities, crisis counseling services, creation of the vaccine depot, supporting vaccine sites and delivery of vaccine and PPE. The SEOC staffing unit included the Agency of Human Services Central Office and the Department of Health, Mental Health, DALE, and Human Resources, and representatives from all agencies and departments who helped employees to redeploy to roles at VDOL, ACCD, VDH, and particularly the dozens of Department of Health district vaccination clinics, in collaboration with external partners from Serve Vermont and the Medical Reserve Corps. The staffing unit responded to 74 separate requests for personnel to perform services for State of Vermont departments, healthcare partners, long-term care facilities, This unit led a really unprecedented effort to recruit temporary staff for anticipated medical and other surge sites. They sent thousands of emails to skilled nursing and LNA populations in Vermont, and also supported the Department of Labor's ongoing staffing efforts. So that's just a sample of what's been going on.
Thank you very much. It's a great privilege to be with you all this afternoon. Happy Public Service Recognition Week. It was 15 or 16 months ago now that Human Resources was asked to help facilitate and manage an online pop-up COVID-19 testing registration system. And at first, they were asked to do that using the registration platform that DHR Wellness uses for our annual flu shot clinics. In June, DHR and other partners constructed a second system on this platform for the farmers to families registrations. Likewise, ADS, who, like all of our agencies and departments, has been incredibly nimble over the last 18 months, worked hand in hand with VDH and other teammates and partners to implement a new registration system for COVID-19 testing. This system that proved to be very resilient during peak vaccination periods continues to be updated for vaccination registration for things like upcoming vaccination of kids, kids under 12, booster shots, and ongoing partner clinics. These systems all required an incredible amount of front-end work and frequent updates. There have been countless hours spent modifying the systems, continuously improving them, measuring everything that we could conceivably need to make it fully informed leadership decisions, being very responsive to changes in our operating environment, eligibility requirements changing or expanding, and particularly in the case of vaccinations. Like almost every aspect of our operations over the last 18 months, these have been truly collaborative efforts. And they have also been highly effective, highly stable, and very scalable. And the testing and vaccination systems in particular, as the governor has mentioned, have surely been critical to our significant forward progress.
So since March 2020, the COVID-19 response team from the Agency of Commerce and Community Development and the Departments of Health and Public Safety managed more than 7,000 emails, phone calls, and web form inquiries from businesses who were seeking more information about how they could comply with the governor's executive orders about the pandemic. Response team members consulted with the Departments of Health and Public Safety and leadership teams to interpret how businesses needed to comply. Team members provided timely feedback to businesses, nonprofits, towns, and individuals within 48 hours of most inquiries. And their diligence resulted in safer workplaces and fewer COVID-19 related illnesses and deaths. And calls were handled with care and professionalism.
Together, the agencies of education and commerce, VDH, public safety, others mobilized to support school-based COVID-19 requests for communications, guidance, data collection, PPE needs, meals to students, coronavirus relief funding, surveillance testing, staff vaccinations, and lots more. By every measure, the response from state government was a model of how systems of government can and must always in the future observe changes in its operating environment, orient to those changes, and take very effective and decisive action. And as the governor frequently notes, and he certainly reminds us of this often in our office, this level of flexibility and competence combined is one of the most powerful lessons of the pandemic, and it's one that I know we all want to work to help endure. For example, in less than a week, AOE, ADS, and a software vendor implemented a system to allow for consistent, timely responses to the many questions that were being asked, and reporting on the types of questions that were being asked by the education system and by the public at large. And this was at a time, as we all recall, that we were just reopening our education system. Susanna?
Yeah, and on those lines, when back when schools were sending students home from school and employers were sending people home from work due to the pandemic, it became really excruciatingly clear that the lack of broadband, universal broadband access across Vermont was going to present a challenge for a lot of us. The agencies of digital service and education and the departments of health and Vermont emergency management and finance and management and libraries all came together to improve Vermonters' connectivity on the whole. They all work to plan, support, and deliver emergency deployment of broadband infrastructure by working together and with community partners to improve broadband access for Vermonters using existing staff and COVID relief funds. So that initiative included the creation of an interactive broadband map, which actually allows users to view broadband speed information for all locations in the state. And users could also fill out a survey, which is integrated within the map, about their internet needs to support children's educational needs and medical care or working from home. So prioritizing areas that had little publicly available Wi-Fi and new public Wi-Fi access points were mounted to the exterior of structures so that we could optimize signal in places like parking lots and other outdoor areas at schools, town offices, libraries. So as part of that project, there were 187 access points installed, which includes at 39 public libraries. Really, really, truly amazing.
Jason.
Thank you. When I saw Secretary Smith, I thought he was going to read the list of dozens of vaccination clinics that he reads at each of our weekly media briefings. I thought we might be here for a while. The Corona Relief Fund, commonly known as CRF, grants management team managed more than $400 million in CRF distribution to employers, nonprofits, rental property owners, downtowns and village centers, and to Vermonters in need. The team set up new programs in record time, created RFPs, processed grants, administered complicated federal grant compliance. They managed the Economic Recovery Grant Program, Everyone Eats, the Recreation Safety Grant Program, the Restart Technical Assistance Program, the Consumer Stimulus and Marketing Grant Programs, the Vermont Housing Improvement Program, and rental and mortgage assistance programs. Again, all done with record and truly incredible efficiency and effectiveness. This work started in April of 2020, which somehow seems like yesterday and forever ago, all at the same time, with planning for economic recovery grants. This involved the design of a totally new grant program, the creation of grant rules, and then they reviewed approximately 3,000 applications analyzing complex tax information, business financial statements, and other supporting materials to ultimately award grants to individual businesses and not-for-profit organizations that were experiencing tremendous economic losses as a result of the pandemic, and that work continues today. But here's the key point of this. Yet another great example. It's that the cornerstone of the successes over the last 18 months, as the governor noted, is in the enterprise-wide effort that we put in. There is not an agency or department that did not contribute significantly to our historic achievements, and because of that, there is not a state employee in any agency or department within any division at any in any part of this organization that didn't make a very meaningful contribution to the progress that we have made. And it's our privilege and honor to reflect today on those achievements and to thank you for them. In this particular case, special thanks go to ACCD, AOT, the Department of Tax, Finance and Management, Department of Financial Regulation, Economic Development, and Environmental Conservation for the work that they did in the specific areas that I mentioned. Susanna?
Thanks. So in addition to all of them, we also have agencies of education and agriculture and the departments of children and families, and public safety, who all came together in their emergency management division work to work with the mass feeding group of Health and Human Services to provide food to Vermonters in need. And in so doing, they use the state's child nutrition providers as a resource, again, collaboration, partnership. And they had school food service programs providing 302,058 meals to homeless Vermonters who were housed in hotels throughout the General Assistance Voucher Program, and schools partnering with the state and Vermont Food Bank to distribute USDA Farmers to Families food boxes.
There's no doubt the unemployment insurance system and the public servants over there who manage it on a day-to-day basis were stressed like never before. We, as the governor noted, we experienced a historically unprecedented increase in cases, and our team over there was equipped with a very outdated 20th century mainframe system that, if we're being honest, it has been well past its ideal efficiency and in desperate need of upgrade or replacement for many decades. This put our teammates there under truly enormous pressure, and with an incredible effort and support from the rest of the enterprise, they stayed on their feet and kept moving forward. Sometimes it was really challenging and there were occasional setbacks, but they stayed focused. They worked through some incredibly difficult days, and together we all got to where we needed to be. Think about this. Over the first 13 months of the pandemic alone, we addressed more than 125,000 new claims, and they all came rushing in right around the same time. That was an average of 1.25 million in weekly benefits, and total, it's always dangerous to do math in public, that's more than $1.3 billion in direct benefit to about 100,000 Vermonters. And again, at the risk of doing some incorrect math in public, that's like nearly a third of our civilian private sector workforce, to put this in perspective. And while addressing UI, 5 new benefit programs were implemented to ensure that all eligible Vermonters and all the Vermonters who really needed some assistance through this very turbulent time received the benefits that they were entitled to under the federal law. So here are a few more specific highlights. ADS and VDOL automated the intake process for the Federal Pandemic Unemployment Assistance Program, more affectionately known as PUA, building and implementing a registration and process for filing claims and support in just a couple of weeks. Over one weekend, as the treasurer alluded to, her office, working with the governor, BGS, finance and management, issued and mailed 8,300 emergency checks for $1,200 to individuals whose unemployment insurance checks were delayed because of the bottleneck in processing. VDOL, financial regulation, HR, DEVA, mental health, taxes, motor vehicles, DCF, BGS, the Attorney General's office, the state police, ADS, transportation, all helped with staffing during peak unemployment. It has been a Herculean task, to say the least, but it proves once again that when we are working together as an enterprise there and we are nimble and responsive, there is literally no challenge we cannot meet. Susanna?
Yeah. So the Department of Forest, Parks, and Rec has the outdoor recreation program, which worked really closely with Department of Health to respond to the significant increase in participation in outdoor recreational activities. And the way they did that was by developing creative solutions to make information available to new and to seasoned recreation users, and overcoming some of the challenges that were associated with maintaining the trails while also protecting the safety of staff and volunteers. And as part of the state's broad suite of economic recovery measures, the program also worked closely with the Agency of Commerce and Community Development to launch an economic recovery grant program for outdoor recreation businesses. And it also served as the state's contact for developing and answering questions about outdoor rec specific to COVID-19 guidance. It's a little bit of what was done. It's a super important part because a lot of us really needed the outdoors in order to weather what was going on in our world. So we're especially grateful for that.
And the list goes on. And even with this long list of examples of extraordinary achievement, I think we're all a little nervous that we're going to overlook something super important. DCF, AOE, ADS, business offices all across state government, business offices and local schools and supervisory unions, their boards, the treasurer's office, everyone worked together to put together a pandemic relief package and projects that prevented food insecurity. Policy changes were made, like increases to 3 Squares Vermont. Red tape was reduced, like implementing easier program rules for Vermonters to navigate and making it easier for them to qualify. And as of April of this year, 41.2 million in extra food benefits were issued to over 22,000 households. These payments continued each month, and benefit amounts increased again starting in May. And when schools were closed, remote or hybrid, we also worked with districts to provide pandemic EBT benefits to families and students who would normally receive free or reduced price meals. Incredibly important work at an extraordinarily difficult time. Susanna?
So in addition to all of this, Agency of Human Services departments worked with Agency of Education and of Commerce and Community Development and with Department of Buildings and General Services and Public Safety and local law enforcement, community partners, basically everybody, to on the shelter and supporting of homeless Vermonters. So this included supporting shelters, PPE distribution, non-congregate shelter options, and that includes things like motels, support for youth and young adults in shelters, providing rehousing support and technology support for children and youth. So the Economic Services Division's General Assistance Emergency Housing Program was adapted to refer those who were experiencing homelessness and who were COVID-19 positive and symptomatic to the Ho Hum Motel, which operated as a designated isolation and quarantine facility. This was really just proactive and collaborative, and it succeeded in keeping a lot of Vermonters who were experiencing homelessness healthy. It had a less than 1% COVID-19 infection rate, which is miraculous. And of course, that's contrasted with a 25% infection rate among people experiencing homelessness across the United States. So we did a lot for Vermonters around the state and of all different points on the housing spectrum, which was big. Jason?
BGS, another example, quickly operationalized COVID-19 mitigation practices like disinfecting frequently touched surfaces and optimizing airflow. They help to ensure the continuous operation of our critical facilities, including our mental health care services, our correctional facilities, of course, the laboratories, including the public health lab, police barracks, and our state emergency operations and health operations centers. Most recently, with BGS assistance, the judicial branch has started to reopen for jury trials, and the legislature has resumed some in-person operations.
So we're talking a lot. We're listing all the things that you all have been doing, but we really just want to express incredible, immense, deep gratitude for all of the frontline staff across state government. You learned new ways to work with little or no notice and collaborated with one another and protected one another's health and safety and that of the members of the community, and really just rose to the challenge in supporting and caring for yourselves and each other and everyone else. And you adapted and remained resilient and reliable, and that is just deserving of so much more thanks than I think we could even provide now.
That was a lot. Thank you, Jason and Susanna, for those really incredibly examples of all the work that our employees are doing. We have about 5 minutes left in the program, so I want to first of all thank everyone who helped with this event, including all the people in all the agencies and departments that submitted ideas about how agencies and departments are working together. I'm also going to single a few people out for thanks. Trevor Audette and Scott Waterman from the Agency of Agriculture, who are responsible for the video content here, and also from the Agency of Administration putting this program on, Melissa Mazapod, Catherine Russell, as well as John Preston, who has been your producer today and showing all those videos. So thank you to all those. Do any of the other presenters have any other comments that they would like to say before I close it out with our last video presentation? Okay. We were not able to present all the content that we collected. So what I'm going to do is leave you with a slideshow highlighting additional efforts that were made from state employees and cross-agency efforts. And it's using the song Dandelion by Vermont musician and state employee Patty Casey. And that will close us out and end the presentation. Thank you all so much for attending today. And thank you for everything that you've done over the past many months. And I know it's been really difficult. And I'm just so proud of everybody. Thank you.